Okay, this is my video for treating a skincare patient. Okay. Hello, Mrs. Smith. My name is Heather, and I will be the nurse assisting Dr. Derm today during your Mohs surgery. Dr. Derm specializes in Mohs surgery and pathology. This means that he will be analyzing the biopsies that are taken today. As you know, you have been previously diagnosed with basal cell carcinoma on your cheek, and that is the most frequently occurring form of skin cancer, and it almost never spreads, so that's good. A basal cell carcinoma is an abnormal, uncontrolled growth or lesion that arises in the skin's basal cells, which line the deepest layer of the epidermis. And the epidermis is the outermost layer of our skin. Okay, and the purpose of the Mohs surgery today is to remove all of the cancerous cells from the skin on your cheek. During the procedure, we will position you comfortably in a reclining chair, much like a dental chair. The doctor will clean your cheek thoroughly with betadine. Are you allergic to any medications, including topicals such as iodine or latex? No? Okay, good. Let's see. Once your cheek is cleaned, the doctor will drape the side of your face with a blue paper cloth, leaving only the cheek exposed. He will then give you a couple of little shots of numbing medicine to help you be comfortable during the procedure. The doctor will then make sure that the area is adequately numb before starting. Okay, and the doctor's going to use a scalpel to cut a very small piece of tissue. He will then look at the biopsy under a microscope and determine if all the cancer cells were removed. This process will be repeated until there are no cancerous cells remaining that they find under the microscope. The entire process could take several hours, but we'll do whatever we can to make you comfortable and be relaxed. When the doctor's finished taking all the biopsies, he's going to close the area with stitches. Now keep in mind that with any kind of trauma to the face or any kind of surgery, there is a chance of some scarring. Dr. Derm is educated in certain closing techniques to reduce scarring, so we will try to keep that to a minimum. Once your incision is healed, we can evaluate any scarring and look at different options if that's something that you want to do, or something that's even necessary. It may not even be necessary. Okay, but the most important thing to do right now is to remove all those skin cancer cells. All right, and it is very important that you follow all of your discharge instructions and to keep the wound clean to help avoid infection. An infection could definitely increase your risk for some scarring. So we want to keep a close eye on that. If you do suspect your wound is becoming infected, please call the doctor right away for further instruction. And I am giving you a list of warning signs to look for. Okay, now let's go ahead and get you scheduled for your follow-up appointment so we don't have to worry about that after your procedure today. Dr. Derm wants to see you back in 1 week from today to have your stitches removed. What day works best for you? Is next Wednesday okay? Okay, great. How about 10:30 a.m.? Okay, great. Here's an appointment card with your date and time. Go ahead and tuck that in your purse. Okay, and now let's get your consent form signed and get you prepped for your procedure. And we can go over any questions you have when the doctor comes in.